Hi, Mrs. Wilson.
Hi, how are you?
I'm good. My name is Stephanie. I'm going to be your dental hygienist while we're here at the BCC Dental Hygiene Clinic. I was thinking we could take a tour of our office so that you feel more comfortable with your surroundings. Does that sound like a good idea?
Sounds great to me.
Awesome. Alrighty, so this is our radiography room. Inside this room there's a dental chair, there's a x-ray machine, there's a sink and a computer.
Okay.
Okay, Mrs. Wilson, before we start our assessment, I was just wondering if you have any chief complaints you want to let me know about.
Well, being visually impaired, it's just difficult for me to manage my oral hygiene, so I need assistance with management and keeping...
Keeping your mouth clean?
Yes.
Alright, so what we're going to do is I'm going to start an assessment so I can see where your oral hygiene is right now, and then after that, perhaps we can discuss some options, so that we can improve that.
Thank you.
Oh, you're welcome. Alright, so before we start an assessment, I want to have you feel some of the instruments before I put them in your mouth, just so you don't feel startled with any of the sensations. So right here, I have a dental mirror. So that has a handle, and the mirror is at the top. That's going to help me see your teeth.
Okay.
And then I also have here an Explorer. Just be a little careful. So this is the handle.
What does this do?
That's going to help me detect any, calculus in your mouth. It's going to help me detect any, restorations and sealants, so I can document that.
Okay.
And then we also have the probe. So what the probe is going to...
That sounds scary.
Oh, it's not scary at all. What it does, it lets me see how deep your tissues are to see if there's any pockets so that I can accurately assess your periodontal health.
It's really sharp. Is it going to hurt?
No, it shouldn't. I use incredibly light pressure.
Thank you.
You're welcome. Alright, so we did finish your assessment so far. There is an indication that you might be at risk for periodontal disease. There definitely needs to be some improvement with your oral health and hygiene. So I want us to be co-therapists in this. I don't want you to feel like I'm instructing you on everything to do. I want this to be a collaboration. So I'll give you a few options and then we can build a treatment plan together.
Okay.
Alright, so the first thing I want to work on is your brushing techniques. So we do have a couple options for patients that are visually impaired. We have toothbrushes that play music that allows you to brush, and when the music changes you move to other parts of your mouth. So that you can hit all the spots you need to. We also have pamphlets. These pamphlets are written in Braille, and they give you instructions on how to brush your teeth.
Okay.
Do any of those sound like a good option?
I like the pamphlet with the Braille, because I'm more sensitive to touch.
Oh, you're sensitive to touch?
Yes.
Okay. Well, I just so happen to have a pamphlet with me right here. There you go. I'm going to put that in your hand.
Brushing and flossing when you're blind.
Exactly.
Oh, that's nice.
Alright, so next I want to work on your flossing techniques. I am noticing that there is some debris in between the contact areas of your teeth, so we do have a couple options for that as well. We have these water flossers, and what they are, they're an irrigation system. You put them in between your teeth, and it'll flush out all the biofilm and all the debris. We also have these floss holders, and what they do is they hold the floss for you, so then you can move along each tooth in your mouth and floss along the way so that you don't miss.
Perfect.
It's perfect?
This one's it's so hard for me to floss, trying to move the floss in between and remembering which area I stopped at, so this one.
Just move it back and forth. You got it! So you can make sure that you hit in between every single tooth. Robyn, so we're finished for today. So today I've given you some tools that should help you improve your oral health. Do you have any questions for me?
You were fantastic.
Oh, that's great. I'm glad.
Am I going to be seeing anyone else, or is it always just going to be you and I?
It's always going to be you and I. I want you to feel comfortable with me so that you're going to be seeing me for all of your frequent appointments. I'm thinking about every 3 to 4 months so that we can assess how you've healed and how you're improving, and we'll make sure that you obtain the most optimum health that you can have.
Okay.
Alrighty, well, it's so great to meet you.
Nice meeting you too.
Okay.